Hello, AWHONN members. I'm Rebecca Cypher, your board president.
And I'm Kathleen Hale, Interim CEO of AWHONN.
Diversity, equity, and inclusion, or DEI, are at the forefront of all our thoughts as AWHONN joins other organizations, companies, and communities across the country and looking at how we can be more inclusive. As healthcare professionals, we are also looking at how to recognize and eliminate bias in all aspects of patient care, especially when working with women and newborns. Racism is as much a health crisis as it is a societal one, and we have a moral obligation to do everything we can to eliminate it in our work, in our organization, and in our individual lives. In June, the board of directors, Kathleen, and I worked together on AWHONN's statement condemning racism and speaking out on the impact that violence against Black people has had on our country. Today, we are here to share with you some of the actions AWHONN is taking to do our part to identify and eliminate racism within our organization. We know it's not enough to talk about eliminating racism. We need to take action, and we have, and we will continue to do so. The DEI task force has transitioned into a standing committee. The board is committed to supporting their future endeavors because we realize that this group's work is critical, both now and for the future of the organization. Currently, an application process for members to join this important committee is being created with specific criteria addressing DEI principles. This will be shared with the entire membership in the coming weeks. We also added a section of questions regarding DEI to our board of directors candidate interviews. A weighted scoring tool was used for each candidate, taking into account their DEI background and their experience. We're asking every board candidate to explain their plans for incorporating DEI into their work for AWHONN. We encourage you to look closely at each candidate's profile on their website. In February, more than 1,000 AWHONN members took part in a survey to gauge our understanding of DEI terminology and principles, the impact of DEI efforts and discrimination at your jobs, and the impact of DEI efforts within AWHONN. Results for the study will be shared publicly in the near future, and those results will be used by the board to form the strategic plan for 2021. In April, we hired Kathleen as our interim CEO. Kathleen is a long-term AWHONN member who's been an ardent supporter of DEI efforts and initiatives within our organization. Her work has been critical as she leads our staff as they continue to work virtually and serves as a liaison between the staff and the board and the organization. The board of directors approved the creation of a new annual DEI Leadership Award. The recipient of this inaugural award will be announced in August. In June, AWHONN's Jogging and Nursing for Women's Health journals released a special article collection on racism, disparities, and social determinants of health. This collection will be open to the public through June 19th, 2021. Our most recent initiative is the addition of a DEI session at our annual convention. This year's convention will be the inaugural year. We recognize this type of programming needs to be more robust, so we're working to incorporate a separate category focused on DEI in the call for sections for our future conventions. Beginning next year, convention will feature a reception and more ways to engage and learn about diversity, equity, and inclusion. Based on input from the original DEI task force, we have decided to create a new AWHONN staff position that will be solely devoted to DEI. Kathleen will be discussing this position in further detail. This is only the beginning. We have a lot of work to do, and there are some difficult but necessary conversations to have. But we owe it to you, our members, to make AWHONN a place where we all belong and where everyone's voices are heard.
As you can see, that's quite a list. But as Becky said, it's only the beginning. We're taking this time to look critically at our organization at AWHONN headquarters, and we're making a commitment to do better. One step is we're hiring a vice president of diversity, equity, and inclusion. This newly created position will help us ensure that DEI and inclusion is woven into the fabric of everything that we do. Our vice president of DEI will be a leader, an advocate, and a catalyst for change. They will help develop programs and activities that support diversity and inclusion, track our progress, and communicate our progress. We are very excited to add this new member of the AWHONN team and look forward to introducing them to the membership very soon. In the meantime, the AWHONN staff has embarked on an 18-month-long education program to cultivate and sustain a culture of respect, professionalism, and inclusion in the workplace. We continue to make progress on our 2020 federal legislative and policy agenda with help from our members. And I'd like to mention some of our most recent activities. AWHONN sent letters to every member of Congress asking them to co-sponsor the Black Maternal Health Momnibus Act of 2020, and we urge them to make passing this bill the highest priority. We've appealed to our section chairs and legislative coordinators, asking them to support the Momnibus Act by calling their senators, writing op-eds, and sending letters to the editor concerning the disparities in maternal health care and encourage passage of the Momnibus Act. I'm happy to report that our members came through with our request, and leading the way with this were Kansas, Iowa, Washington, and California. This week, AWHONN participated in the virtual 2020 Black Maternal Health Caucus Stakeholder Summit. The theme was Passing the Momnibus and Promoting Black Maternal Health in 2020 and beyond. This very important event was convened by the House Black Maternal Health Caucus. The information that they shared will continue to help in our work to improve the health of women and infants of color. In addition, we'll be releasing a position statement about health outcome disparities for people of color and other underrepresented communities. As we look to continue at how AWHONN can improve, we must look at our internal groups and programs. In 2008, the original charter of the Emerging Leaders Program identified the goal of fostering the development of diverse AWHONN leaders. We were very thoughtful and intentional and went back to that original charter while we were selecting this year's Emerging Leaders. This year's cohort reflects the vision of what the program was meant to be, and we look forward to continuing this renewed commitment to diversity in future cohorts. AWHONN has also partnered with other organizations on grants and programs that focus on identifying and eliminating bias in healthcare. One example of this is our work through a Merck for Mothers grant, where we are collaborating with 3 other organizations, including the National Birth Equity Collaborative and the Black Women's Health Imperative. NEBC worked with AWHONN to adapt the post-birth warning signs program to better educate nurses about racial disparities in maternal morbidity and mortality, and the corresponding effects of bias and racism on health. And we're working with BWHI to get direct feedback from Black women and RN providers on the impact of bias and racism on maternal health outcomes for Black women. In addition, the selection for volunteer leadership positions now includes DEI trainings and additional resources for staff and leaders.
In the future, we hope you'll consider completing an application for the Board of Directors positions or the National Committee or Task Force. We're looking for new voices, new ideas, and new approaches in carrying out the mission and the vision of AWHONN. Together, we will move forward in our transition to being a progressive organization that meets the needs of today's members. Thank you for being our partner through this process as we build a better, a stronger, and a more inclusive AWHONN.